All right, again, good afternoon. I'm Dan Duncan. I'm the Vice President for Impact Strategies at CTK, Community Technology, and we have a company that's dedicated to the nonprofit world. We have software to help funders, community foundations, United Ways, and agencies track their outcomes and results. And just a little bit about me, I joined CTK last year after about 30 years as a funder, although I was in the United Way world. So I was a United Way professional in a variety of United Ways over the years. And in addition, I am a adjunct faculty member at the Asset-Based Community Development Institute at Northwestern University. So a lot of the work I talk about really will be based in asset-based community development principles as we go through this work. And this is, and I know in Cincinnati you have some really good people that understand ABCD work.
Yes.
Yes, Byron White and a few others that I know very well. So in fact, this is a part of a three-part series. The first one is around community engagement. The next one is about tracking outcomes and results and how to help your grantees focus more on outcomes and results and tracking them. And then the third one in the series is on alternatives to needs assessments. How do we really effectively engage our community and find the information we need to make a difference in our community? So with that, I will jump in. Again, because there's only three of us, we'll make it interactive, so stop me at any point if you have any questions or comments. Is that all right?
Yep.
All right. So again, the objectives of this webinar is to understand the difference between community level results and program outcomes, the principles of effective community engagement, implementing effective community engagement strategies with limited resources, and data collection strategies for greater impact. And understanding the difference between community level results and program outcomes. I've seen that with a number of funders, and particularly United Ways. There's been some confusion as they've moved to their new work and understanding the difference between the two. So many funders today have developed what we call community-wide long-term strategies or strategy statements that focus your work because we can't be all things for all people if we're going to achieve impact. Community foundations have a unique function as community foundations have kind of evolved because you want to meet the needs of your donors and your donor-advised funds, at the same time trying to make a significant difference in your community in some specific areas. And I assume that's correct for both of you. So again, here's some samples. The Annie Casey Foundation, all children need and deserve lifelong connections to a safe and caring family. In Austin here, our community promote community-wide wellness. But there's been some confusion because community-wide outcomes and the associated indicators, those are collected from community-wide data, not agency data. What I see again with some funders is trying to roll up individual client data or outcome data from individual grantees up into community-wide indicator data, and you really can't do that. They're two different things. The community-wide outcome indicators, that needs to come from community-wide sources like the school district if you're tracking graduation rates, census data if you're tracking income levels, health statistics from your health department if you're tracking those kinds of things. So your individual agencies or grantees, they should not and cannot be held accountable individually for changes in the overall community-wide results. They contribute to it individually, but they can't be held responsible for it. But at the same time, they can and must be held accountable for their results. So if they said 80% of the kids in their program are going to graduate from high school, then they need to track that result and make sure that that does occur and that they are doing their best to make sure they achieve those results. But they shouldn't be held accountable individually for changing the overall graduation rate at a high school, because it takes more than just individual agencies and programs to do that. It takes the community. So here's a sample again using our system. If you're tracking community-wide data, here's a sample of tracking graduation rates. Again, that data is secured from the school district, put into a system where you can track that and show changes over time. Here's a sample then at the outcome program by program level, and this is a sample of agencies that we're working on, and this is a sample of data from agencies that were doing an after-school program, and they were doing pre and post tests to track actual results, that kids were learning new skills. So you can see, you can track individual agencies. This agency said 1,000 kids would do better on their post test and during the year, and 967 did better. So you can see you can track that kind of information, and you should track that at a program and agency level. And again, you can also track demographics and those kinds of things if you want. So here's tracking demographics from agencies. So does that make sense, the difference between community-wide and agency outcomes and results?
Yes. Yep.
Okay, great. You probably already knew this. So the principles of...
Always for the review.
Okay, good. So the principles of effective community engagement. The first thing, when we engage the community, sometimes, for example, we decide on a community-wide outcome like a high school graduation, or more families financially stable, or whatever that issue is, health-related issues. And then as funders, we think we have to sort of do an opinion poll to find out whether people still care about that strategy or that issue. And so I would suggest that community engagement means you don't do that. It's also not about convincing or organizing the community to care about your agenda. But what it is simply about, and not simply, but it's very simply about identifying the individuals that already care about your agenda and mobilizing their action. Because there are plenty of people in a community that care about the issues that you care about. And there's a very important reason for that, and that's because we need people to make a difference in a community. We need both services, and we need people engaged. And so how do you engage people to share their gifts or get involved in your activities of what you're doing? Is you focus on the gifts of their heart. You focus on what they care about. So you have to take the time to get to know people in a community, in a neighborhood, whatever that may be, to find out what they care about. Because so often what I've seen agencies and programs do is try to recruit volunteers to do their to-do list, the agency's to-do list, and then spend all their time trying to figure out how they motivate the people to accomplish what they wanted, rather than taking time to focus on the gifts of the heart so that we find out what people care about, and so we get them involved, and then we get out of their way. Does that make sense?
Yeah.
So the key is in community engagement and doing some of this work is to take the time to identify what we call everyone's gifts and passions. Take the time to find out what skills and abilities people have that they would like to contribute to their community, and finding out what their passions are. What do they care about? Do they care about kids? Do they care about safety? Do they care about health, seniors, or do they care about dogs or animals? And then once you identify those gifts, asking them to share their gifts, asking them to get involved, and to build the power. What a funder or an agency, a nonprofit can do is find ways to connect people with the same passion to act collectively. So that's the real power of this, is how we can find the 5 people in a neighborhood that all care about kids and connect them to work collectively with kids. And actually in the third webinar, I'm going to drill more down on how to specifically do that and what are some strategies for that. But did I hear somebody had a question?
No, sorry.
Okay. So implementing effective strategies with limited resources. How do we kind of begin to do that in today's world? And as I said, the issue is that effective community impact requires both care and service. Just funding the best services that we can and making sure that agencies and grantees are doing a great job is wonderful work, but it won't always achieve the results that we want in our community. It's not enough to build a strong, caring community. We need to also focus on care. And what care is when people are involved and people are sharing their gifts and are engaged in their community. And part of the reason for that, there's a wonderful book was written a couple of years ago called Getting to Maybe, How the World Has Changed. Has anybody heard of that book?
No.
No, it's a great book. It was written by 2 folks from Canada and 1 from America, Francis Wesley, Brenda Zimmerman, and Michael Patton. And they talk about really how real change occurs in the real world, and it's often by just ordinary people, and by ordinary people getting involved. And part of the other thing they talk about that I think is really helpful for us as funders, for my work as a funder, is that we need to understand that there are 3 kinds of problems. simple, complicated, and complex. A simple problem is baking a cake. Again, if we bake a cake, it has a recipe, a few ingredients. If you follow the recipe, you end up with a good cake. A complicated problem is like sending a rocket to the moon. It has the same thing, though, it just has a rigid protocol, formulas are needed, but you follow the recipe, you follow all the steps, and you will in fact get to the moon, because all of the variables always act the same way. The complex problem is like raising a child, and in that case the variables don't always act the same. So because of that, unfortunately, while we have the best intentions and we do all the same things, we don't always end up with the same results. Just like raising a child, if you're in a family, you have two kids, you try to raise them the same way, they turn out totally different. So that's one of the things that we have to do with the agencies and grantees that we fund in our programs, I believe, is make sure that we're not setting them into rigid logic models that don't give them a chance to change and adapt to the changing environment, the changing people that they're dealing with, or the individuality of people they're dealing with. So, and that's why it's so important that agencies need to have data and information so that they can make the mid-course corrections that are necessary to really achieve results for their clients. The other way to think about it, which I think is really important, is Elizabeth Shore. Some of you may have heard of her. She's at Harvard University, and she's involved in how can we help agencies, programs, and communities really make a difference. And she spoke at a conference a number of years ago where I was listening to her, and she highlighted 5 key things that are important if we're going to really make programs and fund programs that work and the strategies that work. And the first one is that we have to be clear about the purpose of our work, the outcomes we're trying to achieve. So we have to focus on outcomes and results and be very clear about that. 2, we must be willing to be held accountable for achieving those purposes. As I talked about earlier, agencies, strategies that we fund need to be held accountable to get the results they said they want to achieve, at the same time not holding them individually responsible for the overall results. And the third one is that we need to create and sustain the partnerships necessary to achieve these purposes. No one institution, no one organization can do it alone. It really requires a commitment of people working together to achieve the results. And the third issue is that we need to move audaciously into the world beyond programs. And what she means by that is that same issue I'm talking about is focusing on care. How do we engage communities and individuals and neighborhood residents to become part of the solution as we move forward? And we have to have the capacity to take community-wide responsibility to assure that the actions that will lead to improved lives actually happen. So I know you all are looking at this, and this is just kind of reminders around this, but these are some of the things that I've found in my 30-year career that have been really helpful to achieve results. Because effective communities look inside first to solve problems. What can we do with what we already have? And that's what I'm going to talk about in the third webinar in this series. Relationships are seen as power. Effective communities have a good sense of their assets and capacities, not just their needs. Leaders open doors, residents are involved, and people take responsibility. So one of the things, again, borrowing from the Asset-Based Community Development Institute and the work of John McKnight, we were at a conference a couple of years ago, and this is a quote from his keynote speech around why community engagement matters. And in fact, Michelle Obama has talked about this as well, that a lot of times people think that citizen engagement, volunteerism, people being part of the solution is just the icing on the cake. And it's not just the icing on the cake, it's actually in many cases the key ingredient if we're going to achieve real results in our communities. For example, there are things that only individuals can be responsible for and achieve great results. The first one is the primary source of our health. And just to give an example on that, if we think about what the World Health Organization says, what are the determinants of health, the first one is personal behavior, personal choices. Whether somebody exercises, whether they eat right, whether they drink or do drugs, all of those kinds of things are the number one most important ingredient for whether somebody is healthy or not. The second ingredient is social relationships. People that are connected and have social relationships tend to be healthier than people that are isolated. So it's important that we help people develop and maintain those social relationships, and that's something that people do. I was listening to a doctor give a lecture at one point, and he said that he runs to stay healthy, he exercises, personal behavior, and when he gets back from his run, he always calls one of his relatives or friends on the phone to talk to them because he knows that that magnifies the power of his run for him physically, and it also vicariously gets them some benefit from his run. The third issue is the physical environment. If somebody is homeless, they're certainly at risk of health issues. If they live next to toxic waste, they're at risk. So the physical environment is important. Fourth one is economic status. Unfortunately, the less income we have, the more we are at risk for health issues, primarily because we can't make the personal choices. And then finally, the least important is access to health care. But we spend all our time thinking that everybody would just be healthy if we all had access to health care. That is not true. People will be healthier because of all these other things, but they do have to have access to health care because if they get in an accident, if they break their arm, if they have cancer, they clearly need to have access to health care. So we want to be clear that everybody needs access to health care, but that alone will not achieve the results we need because people need to be involved. The next issue is safety and security. It's important that people are involved in that. The neighborhoods that are safest are ones that have the most social efficacy or the social connectedness. So it's important that that happens. Another story, I was working in a neighborhood and this woman highlighted that when she came home one day, all of her things were gone out of her house. Everything was gone, including her house, including her dog. She called the police. They came too late. But when they got there, they interviewed her neighbor across the street, and she highlighted that she had, he asked, well, did you see anything suspicious? And the neighbor said, well, no, I didn't see anything suspicious. All I saw was this big white moving van come up to the house and load up all of her things, but because I did not know her, we didn't have a relationship, I assumed she was moving. So the very act of them having a relationship, of being connected and having a social connection, he would have known she wasn't moving, he would have known she was being ripped off, and he could have called the police and they would have come before it was too late. So safety and security is a lot about people. The future of our environment is clearly people have to be involved. Building a resilient economy, people have to be involved. Raising our children, it takes a village to raise a child, that's very clear. So it's very important that we have both care and service if we're going to achieve the results that we need to achieve in our communities. And I really believe that's the role to a large part of funders, to help set that stage so we can create both care and service in our communities where we call our communities we call home, because everyone should have the opportunity to be a producer of their own and their community's well-being, because it takes everyone to build a strong, safe, and supportive community. So before we move forward, let me stop there and see if there are any questions or comments or ideas, or just to check base and see if this webinar is making sense for you or is being helpful. So again, to take yourself off mute, *8 will do that. So let me see if there are any questions or comments.
This is Latoya at the Greater Cincinnati Foundation. I just had a comment. I think all of your key messages are really important, and I think the foundation does have a role to play, and we shy away from the caring part of it, getting the right people engaged and actually being involved in the community. Everything is so, we deal with executives and professionals, and we see the problems perpetuating, and that's one of the reasons that we're trying to solve community problems without giving others the opportunity to be a producer of their community's well-being. And I'm curious, as we go along, if there are specific strategies or anything that can help move us in that direction a little more.
All right, great. Well, thank you. And that, as I said, that'll be a large part of, we'll talk about some today, but that'll also be a large part of my webinar on on September 29th. So let me part of some strategies to kind of drill down around that. There are some questions that we could ask as part of our strategies of when we fund agencies and programs. And part of that is really being very clear about what functions could neighborhood people perform by themselves. Have that dialogue among ourselves, with the community, with our grantees. Are there things you're doing that really could be performed by the neighborhood themselves and we don't have to do them? Just to give you a quick example of that, was working with a number of funders in United Ways that have the strategy of getting around early education, of making sure that there are books in every house in a neighborhood that has kids, making sure if there are kids that there are age-appropriate books in the houses. So again, if our goal is to make sure that in every house there are age-appropriate books, our usual approach to that is we've got to write a grant, we've got to fund an agency, we've got to fund a program, we have to put some money to that issue. And what I would suggest is that that's a perfect example of something that people in a neighborhood could handle themselves. In every community, in every neighborhood, there are 2 or 3 families that would be more than willing to organize the book drives in their neighborhood to make sure that all the kids have books. In fact, one example in Wichita Falls, Texas, the United Way there partnered with the local Armed Forces base, the Army base, and the Army base took on the goal of running book drives and raising books for this effort, and they ended up with more books than they could possibly use almost. I was at their office one day and there were books piled everywhere in the United Way's office, and they did not have to spend 1 penny to do that. So that's an example of how we can get smarter, I think, about how do we do our work. We don't have to do everything by leading with money, and we don't have to do everything which is about programs and services. There are many things that people can do themselves. A neighborhood could do a community garden, etc. So that's the first question, being very clear about, is this something we really need to do, or could the citizens, the residents, do it themselves if we just ask them? Because the main reason people don't do anything or not doing things is that we haven't asked them. So that's the second one. What functions can neighbors achieve with some additional help from institutions? And that may be as simple as asking people to get involved and providing a framework, providing some training and support so that they can do those kinds of things. So the second question is how could we help and what could we do together? But in many cases, again, the neighborhood doing it themselves, we're just doing a little bit of the neighborhood organizing, we're just doing some of that identifying and asking. And then the third question is, what functions must institutions perform on their own? There are many, many things that agencies should only do and can only do, and we ought to be clear about that. For example, if I break my arm, I don't want my neighbor setting my arm because they think they can do it. I really want to go to a doctor. If somebody needs to go through detoxification because they are addicted to some substance, we want that to happen in a medical model and not in somebody's backyard. So let's be clear that there are things that institutions can do, and there are some very clear services, but they don't have to do everything. So the new role of institutions may be beyond just providing service. The way I like to think about it is that institutions as agencies and programs, our primary goal ought to be to remove barriers so that people have the opportunity to be a producer of their own and their community's well-being. And part of the reason for that is that there really are 3 roles that people can play and do play. I play this role, you play this role, the people, our agencies that we fund, serve, play these 3 roles or have these opportunities. At times, they do need to be a client, a recipient of service. In that case, the professional, the doctor, the teacher, whoever that may be, knows what we need. So it is about clients, it is about dependency to a professional or a paraprofessional, but that's all right. And in this case, agencies and funders are in control, and it's about service, not care. So that is one role that people at many times have to play. The second role is advisors. So people as advisors for institutional action, and we have gotten kind of good at that. So we do now know, and we do get engaged in many of our agencies. We do ask the clients, what do they need? What kind of services do you need? How would you like us to deliver the service? But it's still to advise institutional action. So it's still about clients, dependency, agencies and funders in control, and service, not care. So the third role is co-producers of their own and the community's well-being, the opportunity to share their gifts, to share their abilities and be part of the solution. And in that case, we ask a second question. Not only what do you need, but now we ask the question, what can you contribute? And this leads to resident engagement. And now we bring in care, not just service. So one of the things, again, as a funder, we did a lot with was really engaging our agencies, our grantees that we funded, to be clear with their agencies that they need to ask both of the questions of the people they serve. What do you need and what can you contribute? And when you do that, you have a better chance to build success and build engagement. So these new questions for greater impact is, what can we stop doing to create space for citizen action? So again, asking our agencies, ask our programs and services, and ourselves at times, what can we stop doing? Because people can do it, and if we don't create that space, we kind of smother people with service. And so one of the things that agencies and funders need to do at times is learn to lead by stepping back and create that space for citizen action. So what can we stop doing, number one, and number two, what can we offer to the community beyond the services we deliver to support resident action? Because all of our agencies, even our own offices, we may have meeting rooms, we may have copy machines, computers, a whole host of things that we could offer beyond our service that would help drive citizen action. So that's the other example. We may have as I'll talk in the other webinar, we may have a vacant lot that can become a community garden for a neighborhood or anything like that. So we need to begin to think of the resources that we have beyond just the services we deliver, the services we fund, to also think of us as a treasure chest of resources that could be used to drive community engagement. But the other thing I like to talk about is from my experience around collaborations, because most funders today are very excited about collaboration. We fund collaboration, we encourage collaboration. We do that sort of top down. To get funded, you have to have a collaboration, which in my experience, in many cases leads to no more than you sign mine and I'll sign yours. You sign my grant request, I'll sign yours, that we collaborate, and that's as far as it goes. Because for me, collaboration that's bottom up, that is really grounded in what do people need, because part of the problem is that agencies, or clients, individuals, when they come to an agency or to a program or service, they typically have multiple issues, because issues kind of travel in herds. So if they're involved in gangs, they probably have truancy problems and a whole host of other things, and probably literacy issues and all of that. So it takes a whole host of different agencies, opportunity, and activities to really help somebody. So what we're really trying to create are those organic collaborations that grow from the bottom up, based on a true understanding of what people need and what people can contribute. So the other thing about collaboration is that organizations do not collaborate, people do. Effective collaborations are based on a common purpose and relationships and trust. So you can have a great collaboration between two agencies, and then one of the key people changes, the executive director or key program person. All of a sudden the collaboration goes to zero. Just because you had that relationship and that signed agreement doesn't mean much when the players change. So you have to always be sort of focusing on that collaboration as based on relationships and trust. So when people come in, you can't assume it's going to continue without spending time building those relationships and trust. I've been involved with a variety of collaborations over my time that I thought were great. We were doing so much, and then a new executive director came in at one of the agencies, and all of a sudden everything changed, because they didn't come in with the same understanding of why we were doing what we were doing, etc. So those are some key activity or key ideas I've had about collaboration that also help around community engagement. So again, I was hoping to have maybe some examples of some of your work. Latoya, you talked about it a little bit. But for Marilyn or Valerie, do you have any comments or suggestions or even ideas or examples of some of the things you've already done that have been built on these concepts?
I think the foundation, we fund a ton of, I guess the Place Matters initiative would be one example, which you're probably familiar with. But they've done a really good job in engaging community leaders. So that's community councils and nonprofit associations like CDCs, organizations that are on the ground, people who live in the community, and who can then work on their own behalf. And I think, so that's just 3 communities and a pending 4th one, and I think we really need to work to kind of just grow that body work, because I think it's a good model, sort of a comprehensive model.
Right. Great, thank you. And then what about Marilyn, Valerie? That was LaToya, right?
That was me, yeah.
Yeah, okay. Marilyn, Valerie, are you still there?
I'm here. This is Valerie.
Okay.
I was just going to say that we have just launched an initiative, Cradle to Career, ages 0 to 18, with specific focus, sub-focus areas. And we are starting to try to deepen our collaborations in the community. And we have obviously a great relationship with our nonprofit grantees and with some pockets of elected officials, school superintendents, and that sort of thing. But we really want to go even deeper in that work to get business leaders, to get neighborhoods, to get everyone engaged in this process and this initiative. And we find it a bit daunting to figure out how to get all those voices at the table and to make them feel like they can participate in a meaningful way. So this is actually some pretty good, information for me to have as we sort of move forward with strategizing on that.
Great, and as I said, the webinar on the 29th will actually be drilling down with even more suggestions on how to do that.
Great.
And how to bring
Great.
folks around the table.
We've also discussed this. We're rolling out a new strategic framework. This is LaToya again.
Yes.
A new strategic framework, and what we found a lot of times when we want to work directly in the communities, and Cincinnati is broken up into 52. So if we're just looking at the city, there's different levels of capacity. So there might be a really strong community council in one neighborhood that can kind of work on its own behalf, and we can just be in a funding relationship. And there are others that are just not ready to, receive and manage funds and then take something to scale in a neighborhood. But with some additional assistance, what we're calling readiness grants, they could get to that place. So it could be training, some technical assistance, et cetera. So we're just now talking about how to structure that and how to go forward with that work.
All right, great, thank you. Well, I appreciate that. Any other comments?
Oh, it's Marilyn. We're being a fairly new community foundation, are just beginning to have grant funds available to do this kind of work. So I'm looking for guidance on how to begin funding program
Great.
in the community.
Yeah.
So.
Good. Well, the second webinar will really help you with that issue as well in the series, which I think is on the 20th. So let me just kind of got a couple other things, sort of data collection strategies for greater impact, because I do think it's really important that you find ways to collect the information that you need to make your decisions, as well as your grantees have the information, real-time information that they need so that they can make the mid-course corrections that's critical. So just curious, we don't need to do the poll, but are any of your organizations using online software right now to facilitate your community impact, your work and results?
We have an online grant system at GCF, and the nonprofits do report their outcomes in the system, but it is not the best, and we are currently working to improve it.
Yes.
And we also use an online grant application system, but we have not yet been able to figure out the best way to get those outcomes and the data collected through that same system, and whether or not we might end up having to go with a completely different system for that part of it, because our current module doesn't work on the data collection piece.
Okay.
Right.
All right. Well, I'm sorry to hear that. We have one that does, so we'll talk.
Well, we're not that sophisticated yet.
Well, and we'll get you ready for that. But again, I don't do these webinars to just sell our software. I really do it because we care about the work we do. But outcomes tracking is important, that you have a systematic data gathering process. And again, you all, I think, understand that and know that. because outcome tracking provides, as I said, the information you need to make the decisions that you need. And for your grantees, it allows them to qualify for more and larger grants and donations when they have the ability to do that. But the other part of that is make sure you're reporting the right data. And that means you have to focus on communication power. Well, funders and donors understand the data. If you're collecting stuff that's really esoteric, it won't tell the story that you need to do. So you have to make sure that it has communication power. Also, does it relate to the community-wide impact strategy? And you don't have to report everything. That's the other issue that we see with a lot of funders or agencies, is they try to get too many data points, collecting too much data. And typically data travels in herds. If one or two things are going the same way, they're all going the same way. So you just have to find the lead horses and collect that data. And then finally, you have to make sure that it's easily collectible and replicable, so that we don't end up with something that's too expensive to do or too hard to find that data. So that's really kind of the key concepts around that, so that you can collect both output, outcome, and community impact data, as we call it. Output, which really tells you how productive an agency is, how many people they're serving, how much they're providing. Outcomes, which are the changes in their conditions, behaviors, knowledge, or attitudes, which is why we do what we do, is just to change conditions. And then finally, community impact, which is what difference are we making on the entire community. So here's just, again, some samples of how you can begin to collect that data. Here's a quarterly outputs tracking, which is showing each agency, each quarter's report, how many people they've served, how many units of service, and then tracking outcomes, how many people are actually getting better, so that you can begin to do that and then be able to dashboard your results. So that's the other key part of it, is how can you then dashboard those results so that you can demonstrate your impact and tell your story to your donors, to your grantees, your volunteers, your board, etc. And that's what, again, we'll focus on over the next 2 webinars, how we can do that and truly make a difference in your communities and our communities as we move forward. It would be helpful for me, if you don't mind, since this is the first one I've done specifically for community foundations. Was this webinar helpful for you?
Yes.
Yes, thank you.
Okay. Well, when you do sign off, there is a little survey, so please take the survey. It will also be available for archive, and I will also email you all a copy of the PowerPoint slides if you'd like to have those, so that you have those. And again, the next webinar, which is effectively tracking and reporting your impact in today's challenging environment, September 20th at 11 o'clock Central Daylight Time. So I think most of you have signed up for that, I believe. So I hope to see you back on the 20th. In the meantime, again, I'll email you with the PowerPoint, so if you have any questions, please feel free to follow up with me. And so if there are no other questions, we'll sign off a bit early.
All right. Thank you.
Thank you so much.
Thank you all. Have a great day.
You too.
Bye-bye.
Bye.